Malaysia is a country in the Southeast Asia region that has a fairly prosperous economy because it has a fairly high per capita income of more than $11,000 US, which is supported by progress in several important sectors such as health, tourism, transportation, infrastructure and education. In fact, Malaysia's progress in the health sector is quite phenomenal because it was the world's best twice in 2017 and 2019, of course after beating the developed countries that used to be its mentors. Malaysia is now also one of the world's main medical tourism destinations because the treatment costs are cheap and affordable but of international quality, so many international patients want to seek treatment in Malaysia while enjoying various attractive tourist attractions to speed up the healing process for international patients. On this occasion I would like to highlight or review news from suara.com about the costs of treatment in Malaysia, where the technology is at the same level as developed countries but the costs can be 60% cheaper, for example in the United States. In the news it was also stated that private hospitals in Malaysia are not allowed to set prices as they wish because the price of treatment has been sealed, aka pegged to the HET system or the highest retail price, such as the price of basic necessities in Malaysia. I want to highlight two main points in the news. One, that Malaysia, by setting low, affordable costs for its people but of international quality with the latest sophisticated health technology at the level of developed countries, shows that Malaysia wants to make its healthcare system the main means for the welfare of its people, because if the people are healthy, then work productivity will increase, which will increase as well as Malaysia's economic prosperity. 2. With the cost of treatment in private hospitals which has been set at the highest rate, prices cannot be fixed as they please. This shows that Malaysia is not a liberal free market country wherein free market prices are allowed to move wildly as business people wish. This would be very dangerous if then implemented by business people in private hospitals, where the prices will definitely be as expensive as the hospital entrepreneurs like. However, Malaysia does not adhere to a liberal free market system, especially in the field of public health, so the cost of treatment in private hospitals is strictly controlled by the government. This shows that the Malaysian government, especially in the health sector, is more oriented towards humanitarian elements rather than business profit orientation elements. Even though it is cheaper and more affordable, this does not mean that the quality of treatment is lower, because the cost of treatment in Malaysia is actually regulated directly by the Malaysian royal government. Because the Malaysian kingdom has set the highest benchmark price standards for treatment, including consultations with doctors, so private hospitals cannot set high prices at will.